Jennifer Pennock, who is with us by way of Teams, Associate Director, Government Affairs, Association of Perioperative Registered Nurses. Are you here with us, Jennifer? Welcome.
Hey, thank you. Thank you, Chair Decker, Chair Driscoll, members of the committee. My name is Jennifer Pennock. I'm here to testify on behalf of AORN as well, and our 860 members who work in operating rooms across the state of Massachusetts. Thank you for the opportunity to tell you that we support legislation to ensure that harmful surgical smoke, which is smoke from burning flesh, is evacuated to protect the health and safety of the occupants of every operating room in the state. You've heard about the dangers and effects of surgical smoke, and you're hearing from the subject matter experts in Massachusetts, so I won't belabor that point. Wanted to mention that in 2022, AORN was pleased to see that the Massachusetts Hospital Association announced their guidance to members to evacuate surgical smoke. The MHA's plan was for member facilities to be surgical smoke-free voluntarily by the end of 2024. And we were hopeful that this plan would work, even though we did recognize that not every facility in Massachusetts is an MHA member and that the program was not mandatory. And unfortunately, MHA's guidance is simply that, guidance. And while 99% of the respondents to AORN's surgical smoke survey this spring indicated their facility has surgical smoke evacuation equipment, as you heard, less than half said the equipment is always used during smoke generating procedures. Legislation like House Bill 2442 and Senate Bill 1482 would support MHA's efforts by ensuring compliance with their program's goals. AORN has educated our members about the hazards of surgical smoke for decades, and in the past 10 years, we have taken this education campaign to states to urge state legislators to enact bills similar to the ones before you today. Our goal with these surgical smoke bills is to change OR practice to ensure that the already available surgical smoke evacuation equipment is used every time surgical smoke is present. And to date, 18 states have enacted this legislation, and Massachusetts is one of 10 states currently considering surgical smoke management proposals. We know from our members that whether a facility evacuates surgical smoke impacts an OR nurse's decision to practice there. Surgical smoke is a workforce recruitment and retention issue. Massachusetts is known worldwide for its top medical centers and superior medical care. In order to continue to attract and retain this top talent, Massachusetts must adopt this important workplace safety measure that 18 other states already have. AORN supports the passage of House Bill 2442 and Senate Bill 1482 and looks forward to working with the legislators of Massachusetts to see this bill enacted.
Thank you. Thank you for your time. At this time, I would like to welcome the panel of Andrea Dyer and Nancy Doe.
Good afternoon, senators and representatives. My name is Andrea Dyer, and I'm an operating room nurse. I'm here today as a witness to what is happening to us every single day in the operating room across this state. This is my bag. These are my inhalers, my allergy pills, my steroid creams, steroid pills, and nasal sprays. This is what I had to carry just to go to work every day, just to be able to breathe in one day in the OR. Because every time we fire electrocautery, every time we use a laser or a vessel sealer, we burn human tissue. It releases toxic smoke into the air, smoke made of carbon monoxide, benzene, formaldehyde, hydrogen cyanide. That's what we're breathing. And the smell, it's the smell of burning flesh, and it lingers. The busiest surgeon might be in the OR once a week. Nurses are there over 40 hours a week plus call. We are standing in that smoke day in and day out. It doesn't just affect us, it changes our health. Our eyes burn, our throats are sore, our lungs wheeze. We go home and we still smell it in our hair and on our skin. We wake up coughing in the night and no one talks about it. During a C-section, when a baby is delivered, their first breath on this earth can be surgical smoke. Not oxygen, not clean, sterile air, but smoke from burning human tissue. Imagine that. When I stepped away from the operating room into my education role, my symptoms improved almost overnight. I went from using my inhaler 4 times a week to 4 times a year. That's how bad it is inside those rooms. Nurses stand in clouds of toxic smoke with nothing but a surgical mask that does nothing. If I knew about this, I probably wouldn't have agreed to work in the operating room. We have the technology to evacuate this smoke. In fact, most hospitals, as you've heard, already have it. We have tools to protect people, but hospitals don't make it mandatory. Nurses just deal with it. Be tough. Don't complain. Breathe it in. We wouldn't let a firefighter run into a burning building without gear. Why are nurses expected to? We are not asking for a great luxury. We are asking to breathe in clean air while we care for others. We are asking for you to see us, hear us, and act. Please make surgical smoke evacuation mandatory. Thank you.
Hello and good afternoon. My name is Nancy Doe. Sorry. I've been a registered. Sorry. Hello and good afternoon. My name is Nancy Doe, and I have been a registered nurse in the operating room for 2 years now. I spend 10 hours a day in the OR for each shift, working alongside surgeons and other staff members, performing procedures on patients in a variety of specialties. While the cases and specialties are so different, they all have one component in common, like surgical smoke. And since every case we perform requires a cardiac device, that means that every case contains surgical smoke, the result of burning human flesh. This smoke, as we've learned over the past 30 years, contains a lot of dangerous components to it, like all forms of smoke, but this smoke in particular adds the dangers of biohazards. Not only are you breathing in carcinogens, but you're also viable cancer cells, viruses, and DNA fragments. We face potential exposure to anything the patient brings with them in their bodies to the OR. There are protective equipment options and policies governing how and when to use these items for so many other situations, like retracting IV catheters to prevent needle stick injuries, yet we're left out in the OR. We have gowns and gloves to protect our skin, masks and face shields to protect our eyes, but nothing to protect our lungs. Of course, the equipment to protect our lungs is readily available. It just doesn't get used because there's no policy requiring its use. Being so new to the field and the profession of nursing as a whole has given me such a great perspective on the impact of this. I remember how I felt before working in the OR, and it was such a scary change to notice all the changes in my body and myself in the car ride home. After a long 10-hour day, changes consistent with smoke inhalation. I had like shortness of breath, dizziness, facial flushing, headaches, all on a regular basis. Mind you, none of these symptoms occurred like this before starting my new job in the OR. It was inhaling surgical smoke in the OR for 10 hours a day that was starting to have an effect on me, and it's something that no one talks about or warned me about. It's scary to think about what kind of damage and infection risk this could expose me to in over a 40-year career. With already such a shortage of nurses in general, and in the OR especially, a warning of this danger would have swayed me into another nursing specialty where I'd have proper protection and policy guidance to keep me safe at work. There are solutions available for protecting OR staff from surgical smoke, but no enforcement to use them, leaving our health and safety still at risk. I love my job, and I love how I get to care for my patients in this unique setting, but I worry for the health and safety of my coworkers and other new OR nurses and myself. I urge you to help us protect us so we can safely continue our work to help our patients. Thank you.
Nancy, thank you for your testimony. Nurses are some of the toughest, most compassionate people in any profession. So for you to be choked up really says something about what you're trying to communicate. And if anyone's ever been in an OR as a patient, the nurses are the last person to reassure you you're going to be okay, and the first people to reassure you that you are okay when you wake up. So thank you for coming up here and sharing your experiences and your concerns. Appreciate it.
Thank you.